Hello everyone, I am Helen Rathi. I am going to learn at the course in the medical physics for first year biomedical students. Medical physics, what is medical physics? Medical physics applies physics principles to healthcare encompassing areas like medical imaging, radiation therapy, and nuclear medicine. Medical imaging focuses on the physics behind medical imaging techniques like X rays, CT scans, MRI, and ultrasound. Radiation therapy that is involves the planning and delivery of radiation treatments for cancer and safe treatment delivery. Nuclear medicine that deals with the use of radioactive traces for diagnosis and treatment of diseases. Next, physics of sound. Now we we are going to say about sound. Sound, what sound? Sound is a mechanical wave that travels in a medium in a longitudinal and straight line fashion. Already we know that sound cannot travel in a vacuum. It requires a medium for transmission as the sound waves a mechanical energy that is transmitted from one molecule to another. In physics, sound is a vibration that propagates as an acoustic wave through a transmission medium such as a gas, liquid, or solid. In human physiology and psychology, sound is the reception of such waves and their perception by the brain, normal sound levels. Normal sounds in the context of human hearing typically refer to sounds within the range of frequencies 20 Hz to 20,000 Hz, that is 20 kilohertz, that humans can detect. The upper limit decreases with age. These sounds also encompass normal breath sounds, heart sounds, and other auditory phenomena. Noise can become a real nuisance in the home or workplace. To reduce the negative effects on quality of life, it's best to aim for an ideal noise level in the home or workplace. Sounds at below 70 decibel generally considered safe. That frequency value, sound noise value 70 decibel, that is safe. Any sound that are above 85 decibel is more likely to damage hearing over time. A sound at a level of 120 decibel will cause physical discomfort. Noise levels above 140 decibel can cause damage to hearing after just one exposure. Ultrasound fundamentals. Sound is classified based upon the ability of the human ear to hear it. Sounds are classified into three. One is infrasound, and another one is audible sound. Finally, ultrasound. Infrasound, if the frequency of a sound is less than 20 Hz. Already I told normal sound range 20 Hz to 20,000 Hz, but this frequency range less than 20 Hz, it cannot be heard by humans and is defined as infrasonic or infrasound. If the frequency of sound is higher than 20,000 Hz, that is 20 kilohertz, which is beyond the frequency limit of sounds that humans are able to hear and is called ultrasonic or ultrasound. Next, what's audible sound? That is sound sensed by young healthy adult human ears are in the range of 20 Hz to 20,000 Hz, that is audible sound. The ultrasound is the most commonly used diagnostic imaging technique accounting for approximately 25% of all imaging examination that is performed worldwide at the beginning of the 21st century. Ultrasound. Now we will see about ultrasound. What is called ultrasound? The term ultrasound refers specifically to acoustic waves at frequencies greater than the maximum frequency audible to humans, which is technically 20 kilohertz or 20,000 hertz. This ultrasound is medical imaging technique that uses high frequency sound waves to create pictures of the inside of the body. Next, we will see about ultrasound in medicine. An ultrasound is an imaging test that uses sound waves to create a picture. This test is also known as a sonogram. A picture of organs, tissues, and other structures inside the body. Unlike X-rays, ultrasound don't use any radiation. Typical frequencies used in medical ultrasound are 2 to 15 megahertz. Ultrasound frequencies that are commonly used in gynecology are between 3 and 10 megahertz. Next, we will see about advantages of ultrasound. What are the advantages of ultrasound? It's relatively low cost, portability of an ultrasound scanner, non-ionizing nature of ultrasound waves, ability to produce the intrinsic contrast among soft tissue structure without the injected contrast agent. And that is example cardiac and vascular imaging, imaging of the abdominal organs and utero imaging of the developing fetus. Use of ultrasound expands for many applications including cancer imaging, musculoskeletal imaging, ophthalmology and others. Next class we will see about ultrasound transducer. Thank you. Thank you students.